We won't sugarcoat it. Diabetes is a tough disease to handle. Around 85% of patients with diabetes have risk factors surrounding their lifestyle choices and pre-existing health conditions. The other 15% of diabetics, that's a different story. This is the case for those who have juvenile diabetes, a type of diabetes that's often misunderstood, from its causes to symptoms and even the name itself. Let's take a deep dive into the not-so-sweet truth about juvenile diabetes. Diabetes is a chronic disease that occurs when your blood glucose, also called blood sugar, is too high because of problems with their insulin, the hormone that regulates glucose levels. In fact, the complete term diabetes mellitus comes from two words with very literal meanings. We talked to Dr. Ariel Ampil, an internist diabetologist at the Commonwealth Hospital and Medical Center, Dr. Uyking-Naranjo, an endocrinologist at the Davao Doctors Hospital, and Wilson Limon, a person with type 1 diabetes, to share about their experiences and expertise.
Diabetes is a Greek word that is likened to siphon or faucet. In the early days, they noted that the diabetics kept urinating frequently. And so they coined the term diabetes to describe that situation. In the 17th century, Thomas Willis noted that there were ants in the urine of his diabetic patients. Mellitus is Latin for honey. So patients with diabetes mellitus urinate frequently with sweet flavored urine. The mechanism to this situation is that there is an elevated level of sugar in their blood.
For type 1 diabetes, this is caused by autoimmune beta cell destruction. That's why the pancreas is unable to produce insulin. While in type 2 diabetes, this is due to insulin resistance. There is still insulin in the body, but it's not working properly.
When I got diagnosed with diabetes, of course, I was super in denial. But then sabi ko, I'm still young, so it's impossible for me to be diabetic. So I was 25 back then. So sabi ko, no, I'm still healthy. So hindi ako masyadong niwala din.
Previously, type 1 diabetes is thought to occur only in infancy and children. Hence the term juvenile diabetes. But however, this can also occur in adulthood. That's why the term juvenile diabetes is now often referred to as type 1 diabetes to avoid misconception that exclusively children can have this disease.
I would not use it. I would not recommend using it because it obviously places an age to the patient. It is possible that you may have young adult patients who would have an autoimmune problem developing into type 1 diabetes mellitus.
There is a common misconception that diabetes is caused by lifestyle choices, most notably excessive sugar intake. This is not entirely true, especially for type 1 diabetic patients.
Unfortunately, some type 1 diabetic patients may be blamed. You became diabetic because you had an unhealthy lifestyle, when in fact, that will be more true for type 2 diabetes mellitus. A common example would be an autoimmune problem. Your white blood cells deciding to kill the beta cells. It's not because you ate a lot of sugar.
I never really imagined myself to be diagnosed as early as 25 because back then I was healthy, I was working out. I lost 10 kilos. And then nagka-cramps yung sa my calf ko banda in the morning most of the time. Before also I experienced when I wake up in the morning, it takes at least 30 seconds before my vision gets 20/20 vision. So blurry pa siya pag mulat ko sa umaga. Yung nag-iihi ako and then super uhaw. Then I realized that yun na pala yung symptoms ng diabetes.
The common symptoms of diabetes are excessive thirst, excessive urination, hunger pangs, so they tend to eat a lot. So there is weight loss despite increased appetite. Sometimes they will feel rash, itchiness, and they will also experience leg cramps or pain.
What are the other manifestations? Blurring of vision. numbness of the extremities, erectile dysfunction may be a sign of high blood sugar.
My dad is type 2 and ako naman is more on the LADA. So it's in between type 1 and type 2. So I'm on insulin and on oral medication.
If you have signs and symptoms of diabetes and you have a strong family history of diabetes, then you have to get a blood test. This includes fasting blood glucose, HbA1c, OGTT, and if you are suspecting to have type 1 diabetes, do an antibody testing in order to confirm the diagnosis.
In my clinic at the Commonwealth Hospital and Medical Center, as well as in other Metro Pacific Health hospitals, the first thing that the doctor will do is make a diagnosis. To diagnose a type 1 diabetes mellitus, I can request for insulin assay. This will differentiate a type 1 from a type 2 if age is not a factor. You want to check if there are already complications.
The good news? Patients with type 1 diabetes can most definitely live long, healthy lives, especially if paired with frequent consultations with your doctor and adapting a good lifestyle.
My advice to those who are scared to take medication is that, well, it's really hard though. Because before, ganun din naman ako. But then, it's for the best naman. And you will really see the difference na pag nag-insulin ka, pag nag-take ka na ng medicine mo.
Having diabetes is not the end of the world. Even if there's no cure, it can be managed.
I'm just thankful because my friends and family were very supportive. They understand that I have these maintenance. So, pag kumakain kami, they consider na saan kami kakain. Alam na nila yung order ko, alam na yung dapat kong kainin. So, nag-a-adjust naman sila. I do believe that people diagnosed with type 1 diabetes can still live a full life. Super malaking factor yung exercise talaga. Nakakatulong siya. Not just to lower your blood sugar, but for your mental health also.
You know, medical advances in diabetes has been impressive through the years. With proper management, you could have a long, healthy life.